Monica Thomas, and today we will be talking about sickle cell anemia. Our objectives are that we want the audience to be able to define what sickle cell disease is. We want them to be able to describe the pathophysiology of sickle cell disease. We want them to be able to identify clinical manifestations of sickle cell disease. We want them to be able to identify what a sickling episode is. We want them to be able to discuss the diagnostic tests that are used to diagnose sickle cell disease, and then we want them to be able to discuss nursing management for a patient with sickle cell disease. What is sickle cell disease? Sickle cell disease is a group of inherited physiology and etiology of sickle cell disease. The Okay, so we have sickling episode, and this is the major event that occurs during sickle cell disease, and it is the sickling of a red blood cell. So sickling episodes, they are most commonly triggered by a decrease in oxygen tension in the blood. Hypoxia or deoxygenation of the red blood cells can be caused by viral or bacterial infections, an increase in altitudes, emotional or physical stress, surgeries, and blood loss. And so the sickle cell cannot easily pass through capillaries or other small vessels. And because of this, it can result in vaso-occlusion, which can lead to acute or chronic tissue injury. And so vaso-occlusion and hemolysis are the hallmark clinical manifestations of sickle cell disease. And sickle cell crisis is a severe, painful, acute exacerbation of the red blood cell sickling, and this causes a vaso-occlusion crisis. And so during sickle cell crisis, the blood flow is impaired by the sickle cells, which causes vasospasms that further restrict the blood flow. And so during this, the tissue can experience ischemia, there can be infarction, necrosis can eventually occur, and this is all due to the lack of oxygen. And shock is a possible life-threatening consequence of the sickling cell crisis because of the severe oxygen depletion of the tissues and the reduction of circulatory volume. And sickle cell crisis can occur suddenly, or it can persist for days to weeks. And the frequency, the extent, and the severity of the sickling episode are all variable and unpredictable, but they largely depend on the percentage of hemoglobin S that is present. And individuals with sickle cell anemia, they have the most severe form because the erythrocytes, they contain a high percentage of the hemoglobin S. Okay, so the clinical manifestations for sickle cell disease. The effects of sickle cell disease, they can vary from person to person, and the severity is due to the genetic polymorphosis. And so many people with sickle cell anemia are reasonably in good health most of the time, but they do usually have chronic health problems and pain due to the hypoxia of the organ tissue. And because of this hypoxia, they usually have damage of organ tissues, and it usually involves the liver and the kidneys. And so the typical patient with sickle cell anemia is anemic, of course, but usually asymptomatic unless they are in sickle cell crisis or having a sickling episode. And so because most individuals with sickle cell anemia have dark skin, to assess their pallor, you're going to examine their oral mucosa, and the skin might have a grayish cast to it. Another clinical manifestation that you'll typically see is jaundice, and this is because of the hemolysis, which is the rupture or the destruction of the red blood cells, and this is common in patients that are prone to gallstones. But the primary clinical manifestation of a patient with sickle cell anemia is pain. And this pain can range from being trivial to excruciating pain. And so during the sickle cell crisis, the pain is severe because of the ischemia of the tissue. The episodes can affect any area of the body or several sites simultaneously. And this can occur in the back, the chest, extremities, the abdomen, which is the most affected area usually due to the pain. And these pain episodes are accompanied by fever, swelling, tenderness, hypertension, nausea, and vomiting, and tachypnea. So, what are some of the complications that a person with sickle cell disease may experience? Well, upon repeated episodes of sickling, there will become a gradual involvement of all body systems. And the body systems that are mostly affected are the spleen, the lungs, the kidneys, and the brain. And so these are mostly affected because they need a large amount of oxygen and they are not receiving it. And so that's where the complications stem from, not getting the appropriate amount of oxygen. And so infection is a major cause of morbidity and mortality in patients with sickle cell disease. And this infection occurs mostly because of the failure of the spleen to phagocytize the foreign subjects, and so it becomes infarcted and dysfunctional from the sickle red blood cells. And so the spleen might become small and repeating scarring occurs. And one of the most common infections that a sickle cell patient will experience is pneumonia. And this is usually often because of a pneumococcal origin. And so the infections can be so severe that it might cause aplastic crisis. And this aplastic crisis is so severe, or can be so severe, that it causes temporary shutdown of the red blood cell production in the bone marrow. And also, acute chest syndrome is a complication of sickle cell disease, and this is described as an acute pulmonary complication, and it includes pneumonia, tissue infarction, and fat embolism. And some things that characterize acute chest syndrome are fever, chest pain, cough, pulmonary infiltrates, and dyspnea. And so, because of pulmonary infarction, they may experience pulmonary hypertension. They might experience heart failure, and they can ultimately experience cor pulmonale. And so, the heart becomes ischemic and enlarged, and there's scarring and retinal detachment can occur, as well as blindness. And so also the kidneys might be injured due to increased blood viscosity and the lack of oxygen. And because of the lack of oxygen, there also might be renal failure as well. Pulmonary embolism or stroke may also occur due to the thrombosis and the infarction of the cerebral blood vessels. The patient may also experience bone changes, which are osteoporosis and osteosclerosis. They might experience chronic leg ulcers, and these result due to the hypoxia, and they're especially prevalent around the ankles. The last complication that they might experience is priapism, and this is basically persistent penile erection. The diagnostic studies for sickle cell disease are as follows. A peripheral blood smear may be used to reveal the sickled cells and the abnormal reticulocytes. A sickling test, it shows the presence of hemoglobin S and can be diagnosed with the RBCs are exposed to deoxygenated agent. And a hemoglobin electrophoresis may be done to determine the amount of hemoglobin S that's in the body. And a skeletal x-ray, it can demonstrate bone and joint deformities as well as flattening. A Doppler study is used to assess for deep vein thrombosis, and an MRI may be used to diagnose a stroke that is caused by the blood cerebral vessels due to the sickling of the cell. Nurse management for sickle cell disease is geared towards prevention of sequelae from the disease or preventing complications of sickle cell. You want to alleviate the manifestations and you want to minimize end organ damage. You do these things by teaching the patient to avoid high altitudes, maintaining adequate fluid intake, and treat infections properly. They need to be immunized for pneumococcal, HIV, influenza, and hepatitis. And because of the respiratory failure is the most common cause of death, as the nurse, you need to be vigilant in assessing for any respiratory status changes. You're also going to give fluid and electrolytes due to the reduced blood viscosity, and you want to maintain their renal function. Transfusion may be indicated when an aplastic crisis is occurring. Undertreatment of sickle cell pain is one of the major problems. People underestimate the type of pain that a sickle cell patient is going through. And during an acute crisis, optimal pain control usually includes large doses of continuous opioid analgesics along with breakthrough analgesia, often in the form of a PCA. You want to teach your patients to ways to avoid crisis and include steps in dehydration and hypoxia, or ways to avoid dehydration and hypoxia. You want to tell them to avoid high altitudes. You want to tell them to seek medical attention as soon as they encounter problems such as a respiratory infection or any type of infections. And you want to teach them about pain control. So for my literature review, I used an article titled Sickle Cell Disease from the National Heart, Lung, and Blood Institute website. And so some great points that they had that I didn't mention were risk factors. And so the risk factor was that in the United States, most people with sickle cell disease are often African American ancestry or identify themselves as black. And about 1 in 13 black babies or African American babies is born with the sickle cell trait, and about 1 in every 365 black or African American babies is born with the actual disease. They also mentioned about getting ongoing care, and with getting ongoing care, they suggested that you should keep regular appointments with your doctor or medical team, and these visits will help to reduce the number of acute problems that you might experience, and your medical team can help prevent complications and improve your quality of life. They also talked about pursuing a healthy lifestyle. They suggested that you should be healthy and physically active. And in doing this, people with sickle cell disease often tire easily, so you should be careful and pace yourself to avoid strenuous activities. You need to get enough sleep. You should eat heart healthy eating, which includes limiting alcohol. You need to drink extra water to avoid dehydration, and you should quit smoking. The last point that they made that I didn't mention was non-pharmacological ways to manage pain. They suggest that you can manage pain using a heating pad, taking a warm bath. You can engage in distracting and relaxing activities such as listening to music or talking on the phone or watching your favorite TV show. They suggest that you can have massage therapy, physical therapy, or acupuncture.